Senior Moments, sponsored by the Empowering Seniors Group on News Talk KVNU, 102 FM and 610 AM.
Good morning. This is the Senior Moments Show. I am your host, Sid Roeder, and my co-host is Bryce Patton today. Good morning, Bryce.
Good morning, Sid. How's it going?
It is going well. Good to be here. Good to be here with you today.
Yeah, I'm stoked to be here. Looks like we have some pretty fun guests today as well.
Yes, we do. We hope that today we have a subject that I can't remember that we've touched on before, so this is going to be fun. We have, and correct me if I'm wrong, Lily, I don't know if you said Knudsen or
Knudsen.
Knudsen.
Yeah, Lily Knudsen.
Okay, Lily Knudsen. I'm European, so I would say Knudsen.
I like it.
Here she is a marketer for Foot Ankle Center of Cache Valley, and then we have Ben Boyer.
Hello.
Hello, Ben. He is a nurse practitioner at the Foot Ankle Center of Cache Valley. And maybe we'll just let me introduce really quick our sponsor, because we always do that at the beginning of our show. And then I'll give you guys a minute to introduce yourself to our listeners. Our sponsor is the Empowering Seniors Group, which is a group of professionals that has dedicated their time and effort to provide information to seniors, their family members, and really anybody who cares. If you would like to learn more about the Empowering Seniors Group, you can do so online at empoweringseniors.info, or you can email us at empoweringseniors.cv@gmail.com, and the CV stands for Cache Valley. And lastly, if you have any suggestions for this show, anyone you would like to see us invite, you can call me personally at 435-512-6406.
That is really kind of you to share your personal cell phone
There
number.
we go.
I'm impressed.
I know Bruce always says that's really brave, but we're in Cache Valley. You'd be surprised.
Yeah.
It's okay.
Yeah.
It's a good place to be. Well, maybe we'll start with ladies first.
Yes.
Lily,
Yeah.
tell us a
Thank
little
you.
bit about you.
I'm Lily. I have been with the Foot and Ankle Center about 4 years now. I've been working in senior healthcare in the Valley for better part of 10 years, and the Foot and Ankle Center has really broadened my horizon. We've seen patients from infancy to older adulthood, but we see a lot of older adults, and we love that population. I've just am really passionate about small business in the Valley, and so it's fun to be part of a private practice that really caters to and is really honestly concerned about the health of individuals in our Valley. And it's been fun to work with Ben. Ben is a recent add-on to the clinic, and we love having him with us. Ben, go ahead.
No, thanks, Lily. Yeah, so I've been with the Foot and Ankle Center of Cache Valley for a whopping 4 weeks already.
Woohoo!
Yep, so I definitely got my feet wet, as the saying might go. Yeah. No, but I've been a nurse practitioner for many years. In fact, I've been a nurse for over 20 years now, and a registered nurse since about 2003. Family nurse practitioner was my training and background. Graduated in '08, so now about 15 years as a nurse practitioner. Have been in the Valley for those same 15 years. I was working in family practice prior to coming over to the Foot and Ankle Center, and was excited about the opportunity to come and work with Dr. Huff, Dr. Wilmore, Dr. Thomas. The whole group and the staff there are just fantastic. It's been a wonderful first 4 weeks.
That sounds great. So maybe we can just for a hot second dive into what services the Foot and Ankle Center provides.
Yeah, we anything below the knee, essentially. That's our area of expertise. And like Ben said, we have 3 physicians. Dr. Huff is actually the owner of the practice. He started the practice over 10 years ago. And 15 actually now.
It's
Oh
been a
my
while.
goodness, time flies when you're playing with feet. Anyway, Dr. Huff is one of our physicians, and then we also have Dr. Wilmore and Dr. Thomas. In addition to Ben, we also have another nurse practitioner named Kim. And Kim Tag is there with us managing our infusions, which is really the service that we want to talk about mainly today. We provide all sorts of a wide variety of foot and ankle health services, including surgery and conservative treatments. And Ben he has worked a lot in diabetes management through his years of being a nurse practitioner, and now he's really diving into that with us as well. He sees a lot of our patients for foot and ankle needs, but he's just an expert in the diabetes realm.
Expert is a strong word, but I appreciate the vote of confidence. And I think, Bryce, it was you that asked earlier, why have an infusion center at a foot and ankle center, right?
Yeah, exactly. Why would you do that?
So, and this actually speaks, I think, to the innovative approach that Dr. Huff tries to take with the organization and with our practice. As most of you know, diabetes is an epidemic, really, in the United States. In fact, it affects over 34 million Americans every single year, and probably an additional 88 million or so are pre-diabetic. And
Wow.
one of the major complications that we see from diabetes is peripheral neuropathy. Peripheral neuropathy is where the nerves, specifically of the feet, but it can happen in other areas as well, have been damaged by repeated pounding by elevated blood sugars. Most of you that have had diabetes or pre-diabetes or know somebody with diabetes probably knows that one of the big concerns is your toes, your feet, and what happens below the knee when you have diabetes. And so part of the reason that Dr. Huff brought Insolutions into the practice was to be able to treat peripheral neuropathy, usually caused by diabetes. Not always. There are other causes of neuropathy as well, but that was one of the main reasons that they decided to bring this treatment and therapy into our practice.
So the treatment's called Insolutions?
Yeah. Insolutions developed this treatment. The formal name is actually Physician-Directed Physiologic Insulin Resensitization, which is a mouthful.
Yeah.
It's a mouthful.
Yeah.
So you'll hear us call it either Insolutions or PIR, so the Physiologic Insulin Resensitization acronym there, so PIR therapy. And Insolutions developed it. It's been around for about 6 to 7 years is all, is gradually making its way across the country. We are actually the 4th clinic in Utah to now have the Insolutions treatment available. And it's been a nice addition already to the Valley. We've had some patients that have transferred up from the closest clinic that's also doing the therapy, which is in Layton, Utah.
So you guys are the only ones doing it here in Cache Valley?
We are.
Okay.
So, quick question from my end here. I assume, as most treatments, it's most beneficial or useful when you catch it early, or is this something that can be introduced at any time?
That's a great question, and I think it's really a combination of both. The treatment is available to individuals that have already been diagnosed with peripheral neuropathy, type 2 diabetes, but most patients can also qualify to receive the treatment if they have prediabetes, metabolic syndrome, which is a combination of different changes physiologically in our body, that to help individuals be able to come and receive the treatment. And so it's not something that everybody can receive, but it's something that most people that suffer from one of those conditions will qualify for and be able to receive from us. And again, peripheral neuropathy, probably the primary reason that we brought it into our practice. And one of the interesting things about it, and we'll talk more about this in one of the next segments, about one of the most exciting parts of what we have learned about Insolutions is that approximately 95% of patients report some improvement with their neuropathy during the course of their treatment.
Wow, that's huge.
It's a huge number in medicine. 95% is a big number.
Yeah, that's really big. How would someone be able to find out if they qualify? Can they just call your office?
They can call the office to get a consultation.
Oh, okay.
That's kind of how we would start out.
Yeah.
Okay. And what's that phone number?
You bet. Yeah, our phone number 435-787-1023. And we're right here in Providence, just on Gateway Drive, 435 North Gateway Drive, Suite 801, right next to Cook Brothers Pharmacy. So
awesome.
Many of you have probably driven past us. So that's where we're at.
Oh, that's fantastic.
Thank you, Ben. We're already getting to our first break here. So just for our listeners, if you didn't catch that phone number, we'll make sure to have Ben give us that a couple more times during this conversation that we're having here. Let me mention before we head out our sponsor again. Our sponsor is the Empowering Seniors Group. If you'd like to learn more about the Empowering Seniors, you can do so online at empoweringseniors.info, or you can email us at empoweringseniorscv@gmail.com, and the CV stands for Cache Valley. We're going to take a little break. Stay tuned. We'll be right back.
This is Mark Thurston with White Pine Funeral Services. The best time to plan is when you have time to plan. Having a prearranged funeral gives peace of mind for everyone involved. White Pine will customize your final wishes to fit your needs, from a traditional burial to cremation to a custom headstone. White Pine also accepts prearranged plans from other mortuaries, and we will absorb any transfer or revocation fees. No penalty to you. Visit whitepinefunerals.com or come and see us for more information.
White Pine Funeral Services, here when you need us most. Hi, this is Bruce with Comfort Care. One of the ways we help loved ones stay in their home is by assisting with daily tasks. These may include bathing, meal preparation, medication reminders, and housekeeping. We even help with shopping, transportation, and errands. Most of all, we offer a trusted level of care. Let us help you live your best life possible with Comfort Care. This is Bruce, and you can call me at 754-7676. Comfort Care, 754-7676.
Did you know 1 in 3 people will visit a nursing home? Did you know that once there, they will stay there for an average of 3 years? Did you also know there are insurance options that can help cover this experience? Hi, I'm Tracy Ferris with Blue Water Health Insurance. It's not cheap to stay in a full-fledged nursing home. Long-term care insurance can help you or a loved one get the care they need and deserve. If you wait until you need it, you may be too late. Give me a call at 435-890-8155.
Reed's Pharmacy in Hiram offers free delivery service 5 days a week, Monday through Friday throughout the valley. Just stay home and they will deliver to you. With 25 different suppliers, they won't have the shortage that others might have. Also, with compounding and many other services, they will be able to serve all your needs. In order to stay safe and help slow the spread, please call Reed's Pharmacy in Hiram at 245-DRUG and they will take care of you.
Welcome back. This is the Senior Moments Show. I'm your host, Sid Roeder. Co-host is Bryce Patton today. Welcome back, Bryce.
Hey, thanks.
We're sitting here today with Lily Knudsen, and I will get that right one of these days, and Ben Boyer. They both work for Foot and Ankle Center of Cache Valley, and we've talked a little bit about some special IV treatments that you have, and I know that Bryce had a question for you.
Yeah, I was just wondering, you're talking about peripheral neuropathy. I mean, what is peripheral neuropathy, and what are some of the symptoms of that?
Yeah, that's a great question. Peripheral neuropathy is damaged nerve cells that occur over time. One of the primary reasons that our nerves get damaged is because of trauma. One of the other reasons is diabetes. Diabetes damages nerve cells because the sugar that is contained in the blood will affect those nerves, and they can't control how they interact with it very well. And so over time, it damages the cells in those nerve fibers and cause them to be either painful, constantly firing. A lot of people describe neuropathy as a burning type pain that they experience quite consistently, and ultimately numbness. And of those symptoms, it can really develop in almost any way. One can be first or the other. Most people experience a little bit of pain, a little bit of burning, and then it goes numb. Other people come in and tell us that their feet just feel numb. They don't feel it. And as a consequence of that, and another reason that we brought this treatment into the Foot and Ankle Center, is that we see a lot of foot wounds, diabetic ulcers, wounds that have been on the feet for a long time. And the problem with peripheral neuropathy is that those wounds could be there, and because of the numbness, tingling, the lack of sensation, you might not even know that that wound was there to begin with.
Oh, wow.
That can get really serious. You're running into things like severe infections at that point, or just the wound getting larger over time. And some people aren't even aware that these wounds are on their feet if they're not looking at their feet daily and they're not feeling it.
Yeah. So we actually now have a nurse practitioner that works with us as well, named Tia Peterson. She's been with us for just a couple of months now, doing specific wound care therapy for people in their homes. She does some in-office wound care, but is going to homes of people that are struggling with these non-healing wounds. And that's just an additional way that we're trying to help take care of patients that deal with these types of symptoms. So wound care and diabetes, foot care go hand in hand.
Oh, that's awesome that you'll go into the homes and do that. That's a huge service.
Yeah.
Is there a radius that you guys will cover, any miles, or is it the whole valley?
You know, that's a great question. I would probably say anywhere within Cache Valley.
Yeah, we typically stay within the valley, and it is case by case. I mean, we do utilize home health services with various companies in the valley as well to provide additional wound care in the home. But Tia can do lots of treatments like that home health nurses can't. Provide, like applying grafts or doing, we have an ultrasound therapy that stimulates wound healing. She can do that in homes. So it's a specific service, and it's kind of up to the physician that's treating the wound when they bring Tia in.
Okay.
Yeah.
Awesome.
So as somebody who has never had to deal with that, and I don't have a family member that has diabetes that well.
Hey, that's good.
How do I have to visualize an assessment? So, I mean, I have foot pain, I give you a call. How does that work?
Yeah, that's a great question. So if you come in to see one of our providers for foot pain, that opens the door for us to have this type of discussion. And then really the process in looking at the specific treatment that we have kind of brought up and been talking about, this InSolutions treatment, would be that after having had an evaluation with the podiatrist or with one of the providers in evaluating the feet, if there is concern for diabetes or a potential concern for diabetes or a history of that, the individual would then be referred over to either Kim Tag, another nurse practitioner, or myself. We go through an evaluation process where we look at previous labs, previous diagnoses. We talk to individuals about their current symptoms, what they're experiencing, and then usually would order a panel of labs, blood work that would help us to determine the severity of their illness, what specific types of illness they may be dealing with that could be contributing to this neuropathy, these non-healing wounds. And that's really the initial step in getting the evaluation done. That first visit is a longer visit. We go through a lot of information. We tell patients to plan on 60 to 90 minutes when you're in the clinic to go through that evaluation together with us.
Wow, so you're pretty thorough going into that then.
Very thorough. No,
Okay.
We want to make sure that not only does the individual need the therapy and qualify for the therapy, but that we can specialize and individualize the treatment for that person.
Okay, so it's just not a one thing for everyone kind of deal.
It's not. The process is similar, but the dosing, the administration is a little bit different.
Okay. Now, is this covered by insurance?
Always a great question, and we want to make sure that it typically is covered by insurance. In fact, so we go through that process. We have to qualify somebody to receive the treatment before we would begin.
Okay, awesome.
So then in the treatment, I'm assuming any wound care happens first. If they come in, how frequent is this necessary? And is there an end to it? Or is this going to be an end of my life?
So we definitely hope there's an end to your wound care, right? We want to get that better. We want to heal that wound as quickly as we can. With the InSolutions insulin treatment that we're providing, it is a process that begins with the consultation. Then you go through an induction stage where you meet with us in the clinic and come prepared to spend a couple of hours there while we initiate the treatment. Out of the gate, that induction phase, we meet with patients twice a week for 2 to 3 weeks to get them started, and then start to taper back from there as we're monitoring symptoms as we go.
Ben, I just want to specify really quick that while we've talked about wound care, having a wound is not by any means the qualifying factor for this therapy. So
Right.
Ben, who should be calling us to discuss the option of this therapy?
Yeah, that's a great question. So non-healing wounds is definitely something to consider, but patients that struggle with peripheral neuropathy, patients that have been struggling with diabetic control through other methods, patients that are concerned they may be pre-diabetic or have been told they're pre-diabetic, this can be a treatment option for all of those people.
So you do not necessarily need to have the full diabetes diagnosis.
No,
Pre-diabetics can
no.
qualify too.
Yep, absolutely.
Okay.
Others can also qualify for that treatment. And in fact, it's important to point out that this treatment that we're offering does not pull away from anything else that your primary care provider, that your endocrinologist may be offering to you. This is an additional tool to help treat diabetes and hopefully see improvement in your symptoms. And over time, the goal is that we can taper that therapy down to not have to come every week, every other week. Each body responds differently to the treatment, and we find a specialized process for you to make sure that you receive the treatment that you need, but it's not indefinite. That's a great thing to bring up.
So what are some alternative treatments, if you can mention those briefly?
Sure. Specifically for peripheral neuropathy, some alternative treatments include medications. A lot of providers use medications that can be very helpful with the pain and burning of neuropathy. We have a treatment called Calmar at the Foot and Ankle Center that you put some little electrodes onto the leg. It helps to stimulate those nerves to try to calm down some of that pain. These treatment options can be very helpful, but oftentimes we find that we need alternatives to that therapy.
Thank you, Ben. We're at the end of our second segment here, and we will mention the phone number again when we come back in after our break. But right now, this is the Senior Moments Show. We're going to take a little break. Stay tuned. We'll be right back.
This is Brian Erickson for the Sunshine Minute. Each day, our nurses, CNAs, cooks and servers, housekeepers, laundry staff, music, recreation therapy teams, office staff, receptionists, and many more arrive around the clock. These heroes show up ready and willing to serve and protect our residents and clients. We are so grateful to our dedicated team. On behalf of the Board of Sunshine Terrace Foundation and our community, thank you to all of our employees for keeping us safe. We bring more to life together.
You have a lot of options when it comes to buying or selling a home. Do you list it online, sell it yourself, or do you have a realtor help? It's a major financial and emotional decision. A realtor is the liaison between buyers and sellers and really helps you navigate complex contracts, deadlines, and disclosures.
Hi, this is Sid Roeder with Achievement Realty. I work for you to get the best outcome for your situation. Let me earn your trust with a free consultation and a free market analysis. Call me today at 512-6406. Then list it, sell it, and move on.
It's tough knowing how to care for an aging parent. Mom has always been there for me, but now I need to be there for her. When we found out she needed surgery, I wondered how I could attend to her needs and still be mom to my kids. I was so relieved to learn about transitional rehab at Maple Springs in North Logan. From the nurses to the physical therapists, it was like their whole staff was focused on helping Mom get better. Maple Springs in North Logan was an answer to my prayers.
Learn more at maplespringsnorthlogan.com or call 753-9400.
Welcome back. This is the Senior Moments Show. I'm your host, Sid Roeder, today with Bryce Patton. Welcome back, Bryce.
Hey, good to be here. We're having fun.
Yeah, we're having lots of fun. We've got Lily Knutson in here and Ben Boyer, and I'm saying this different every time. They both work. Ben is a nurse practitioner at Foot and Ankle Center of Cache Valley. And we've talked about peripheral neuropathy. Ben's explained what that is. And I promised when we lead back in that I would get your contact information and your location out again. Ben.
Absolutely.
Yeah, you betcha. So we are the Foot and Ankle Center of Cache Valley. We're located at 435 North Gateway Drive, Suite 801 in Providence. Our phone number 435-787-1023. Thank you for getting that in there.
Absolutely, absolutely. And when we left out of our last segment, we were talking a little bit about the process of coming in and having an assessment. Do you want to just remind our listeners what the process is like?
Sure, and then we'll kind of jump into the next step. So if somebody is concerned about peripheral neuropathy or some of these symptoms that we've been discussing, diabetes, non-healing wounds, come in for a consultation. If you qualify and are interested in pursuing InSolutions, then we would start the process of providing that treatment to you. The specific process is you come in.
Hey, wait a second.
Oh, sure. You got a question, Bryce?
Yeah. Now, do you need a prescription or a recommendation from your primary care doctor, or can they just call you directly?
Yeah, great question. I think most patients are able to just call in and request a consult.
Absolutely.
Okay, perfect. Yep. So you don't need to go to your primary care first.
No, and this doesn't require a prescription because we're actually administering the treatment on site.
Okay, perfect.
And so the prescription is us being there doing it, which is very good.
Okay.
So with the treatment, once you've qualified, we've got it through your insurance, we're ready to go. You come in, we have a treatment room where we have 5 to 6 different reclining massage heated chairs because you'll be sitting there for a couple of hours.
I am so coming over.
Right?
No kidding.
You'll be there for a couple hours, so we want that to be very comfortable for our patients. You come in, we do some vital signs, we start an IV, we check your blood sugar. And that blood sugar will be checked frequently throughout the treatment. With that blood sugar, and based upon your individualized dose of insulin infusion, we start the treatment, which is connected to a small little pump that sits right by your side. You're able to get up and walk around the office a little bit if you need to, or you can sit and enjoy whatever you want to enjoy while you're sitting, whether that be, a lot of people bring in books or watching things on their phone. We do have a TV in the room. But during the process, you'll have your blood sugar checked frequently. We'll be adjusting your dose. And really what it is small little doses of insulin being administered every 4 to 8 minutes over the course of 2 to 3 hours time. We set targets of where we like your blood sugar to be. We help you get there by either administering insulin or having you drink a little bit of glucose to bring your sugar up if that's needed. We call it our flight plan, where we try to fly you pretty steady, and then we land you down at a number that you're comfortable with and that we feel excited for you to be able to leave the clinic safely. We do follow-up phone calls to make sure that everybody's good to go. It's really been a great process to work through with patients. That same process, the first couple of weeks, would be twice a week. Then you go to once a week. And then, as I mentioned, every other week. And then most patients end up at once a month. I mentioned earlier that it's not designed to be indefinite, but a lot of patients don't want to stop the treatment because of the benefit that they receive during it.
Mm-hmm. So what kind of benefits are they receiving? Yeah. And how quick do you see those results?
And I would say that this is really what sold me on this whole process. Okay. We went to a training in Houston where InSolutions began, and it was the patient testimonials of what was better. Their neuropathy was better. Their sleep was better. Their nerves didn't hurt or fire as often. Because really the way that it works is it decreases insulin resistance. It increases the amount of sugar that's leaving the blood and going into the cells, and it's helping in the process of converting that sugar, that glucose, into energy for all sorts of processes, and specifically for the improvement of these types of symptoms that we see with long-term diabetics. So improved wound healing, better sleep. Some people report that their hair grows better. I mean, there's a lot of potential benefits from it. And really, sleep and energy are probably the first two. Neuropathy, because it is a long-term process, is not a quick fix. It takes a while, So sometimes we won't see changes in their specific neuropathy treatment for the first 2 to 3 weeks. It could go out to a couple of months. But we've only been doing this now in our clinic for about 2 months now, but are already having patients come in, describing the benefits that they are seeing: energy, sleep improvement, pain starting to calm down. It's been super intriguing, and we're just really excited to be able to offer it here in Cache Valley.
Oh, that sounds amazing.
So do you have like an average how long you usually treat people with this?
Not yet. That's still part of our research that we're gathering with InSolutions to determine kind of how long it takes before somebody is just on the maintenance phase. Most of the time, though, we'll be able to reevaluate your condition every 3 months. So we draw the initial labs, we do the treatment for 2 to 3 months, reevaluate with another set of labs and your report of symptoms, and then move forward from there.
So you mentioned maintenance. We're almost at the end of our show, but I need to hear, when you talk about maintenance, what does that entail?
That usually entails receiving the treatment about once a month.
Ben, we're sadly at the end of our show, and so I want to make sure before we head out that you get a last chance to mention your phone number and your location to our listeners.
No, thank you so much for having us today, you guys. It's been a pleasure. This has been a lot of fun to be with you. So we are the Foot and Ankle Center of Cache Valley, located at 435 North Gateway Drive, Suite 801 in Providence. And our phone number is 435-787-1023. Please come check us out. This is truly a fascinating treatment, something that I have not seen in my 15 years as a nurse practitioner.
Super. Thanks for coming in, Ben and Lily. This is the Senior Moments Show. We are at the end of our show. We hope you tune in again next week.